This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, hey everyone, welcome. Thanks again to PM&R Scholars. I know this is 3 years running. This is a fantastic event, so thanks for all the hard work and everything going behind the scenes to make this possible. So my name is Nick Elwert. I am the Assistant Program Director at the University of Kentucky's PM&R program. I am joined tonight by Dr. Key, our Program Director, and Dr. McDermott, who is one of our all-star PGY2 residents. So what we're going to do is we're going to hit the highlights of our program. I'm going to try to be as not long-winded as I normally am, as Dr. Key will agree, and so we have time for questions and such. So let's go ahead and get started. So these are our residents. This is last year's class. So our fours were Dr. Mars, which is right here, and Dr. Abdel Sayed. Both of them matched into interventional pain. Dr. Ilkinich and Dr. Wilczek here both went into private practice, and then Dr. Parrott, who is right here, went into, he stayed on, which we are so lucky that he stayed on and is doing outpatient musculoskeletal care. So here's what we're going to outline. So we're going to talk about the highlights and the basics of our program, our resident schedule, our wellness initiatives, which is one of Dr. Key's babies and very close to her heart, and then our didactic schedule. And then we're going to highlight two of the big locations that we do our residents do rotations. And then we're going to talk a little bit about Lexington. Some people may not know much about Kentucky or may not know everything that we have to offer. I will say this is probably one of my favorite pictures. So this is this year's PGY2 class. This is when they were ones, getting all fitted in that nice white coat, getting ready to start intern year. So let's talk a little bit about our program leadership. Our department is chaired by Dr. Susan McDowell, and our vice chair is Dr. Salas. As I mentioned, Dr. Key is with us tonight. She is not only our residency program director, but our brain injury fellowship director as well. Dr. Cavanaugh is our chairperson of the CCC, which is our clinical competency committee, and then I am our APD and our research advisor. Because the slide is only so big, we had to kind of spill over our leadership to the next page. And we have Leslie, who is our amazing program coordinator. She keeps everything running behind the scenes and does an amazing job. And then these are our chiefs this year. So here we have Dr. Murphy, who is our academic chief, and Dr. Dixon, who is our administrative chief. If you ever get a chance to meet Dr. Dixon, he loves this picture, but now he doesn't have much hair up top and has a big old beard. He said it just kind of went down to his chin. So you can tell him that if you see him. All right, so here's some of the basics of our program. So we are a 4-year categorical program, and we have 5 residents per year. I think one thing kind of going is highlighting some of the benefits of the program. Now, don't get me wrong that this is not an all-inclusive list, but these are the things that we wanted to highlight. So as a PGY1, you receive both the Bradham and DeLisa textbooks, and then you also receive an iPad. This iPad, we have Epic at our main acute care hospital, and we have some current PGY 1s and 2s that are really savvy, putting in orders, rounding with them, writing notes, all from an iPad. So you get that when you start. As a PGY2, you get 2 texts that are related to PM&R, and it is whatever your interests desire. So For example, Dr. McDermott is at this time interested in PEDS PM&R, and so she is going to most likely utilize those texts into doing PEDS rehab. And there really is, I think the cap on this is there's no way a book would be that cost. So if it's 2 books that are going to help you out, that's what we want to provide. You also get a laptop that you can use for documentation. We have docking stations that go to main screens in our resident room at our acute rehab facility. And then there's a host of other texts, and every year it's changing. We have oral board books, TBI text. We also had one of our attendings provide PM&R recap to our residents this past year. As a PGY3, you get a $600 educational stipend, and this again can be used for conferences that are going to help you on your educational pursuits. Could also be used for board review courses. So I was a graduate of our program, and I used part of that money on PM&R recap. And then as a PGY4, you get a $1,400 lump sum educational stipend. Typically, this is used for either a board review course that you travel to, or can help offset the cost of boards because, as we all know, those are not inexpensive. Every resident gets a minimum of 2 paid conferences. So as a PGY3, you go to AAP, and as a PGY4, you go to AAPM&R, and this is no matter where the location is. And it doesn't matter if you do or do not have research that you are presenting. So if you are a PGY3, you are required to submit something to AAP, but if it doesn't get accepted, that's okay. You're still going to the conference. And the same thing for a PGY4. And then each year, there are 4 travel awards that are awarded to residents for their research. So we do these typically on a quarterly basis. Being the research advisor, I help facilitate it. And essentially, this is to help sponsor residents to go to national conferences, because we know that not only does it help you with networking and for fellowship opportunities, but you're also a representation of the program. And so that is essentially an all-inclusive trip paid travel stipend. And you also get days off that do not count as vacation days. So you get educational days as well. So you can go up to you could potentially go up to 4 conferences per year and get the day before, the day of, and the day after your presentation off. Gives you the opportunity to really network, and we want to support you doing that. To kind of finish up some of the highlights of the benefits, everyone each year gets personalized scrubs and white coats. We also get a food stipend, and you get free parking that is provided by GME. So let's talk a little bit about the rotation schedule. So we're going to break this down by PGY 1 year. So this is our PGY 1 year, and I'll be honest with you, I would match at the end of our PGY 1 year, I would match our interns up against anyone. There is no ifs, ands, or buts about it. It's a tough intern year, but at the end, you are ready to rock and roll, and you can handle anything that comes to you on the rehab unit. So you can see here, you start off with 4 rotations or 4 months of internal medicine split between the VA and Chandler Hospital, which we'll talk about here momentarily. Neurology, that is split between stroke and general. You have 2 months of orthopedic surgery. One of that is inpatient and one of that is outpatient. You also do outpatient peds for a month, neurosurgery for a month. You do sports and pain, each of those 2 weeks. You do 1 rotation in trauma, and then 1 rotation in UK PM&R. We wish we could give more and do more with the PM&R rotation, but with ACGME and only being able to do 1 PM&R rotation, we'd love to do more, but this is, we thought that this was a really good PGY 1 year. And like I said, our residents come out very prepared. And this has changed throughout the years. Every year, our Dr. Key asks for advice and how all the interns thought the year went. And just this year, the sports medicine and pain selective is new. Because we wanted to switch some things around, and we know that there's a significant interest in sports medicine. And so we wanted to make sure that you guys had exposure very early with the sports medicine colleagues, so you could start networking and start your research endeavors. Let's go to PGY 2-year. So one thing that I love about our PGY 2-year is you get half of your inpatient education during your PGY 2-year and half of it your PGY 3-year. Doing a lot of inpatient during your PGY 2-year, it can get a little exhausting. And the last thing you want is to be burnt out at the end of your PM&R PGY 2-year. And so typically you do 2 to 3 months of stroke rehab and 2 to 3 months of brain injury rehab. And then you also are doing outpatient for the rest of the month or for the rest of the year. So you're going back to sports and pain. You come to this rotation called Cardinal Hill Clinic 2. So this is in our Cardinal Hill Clinic where you're seeing outpatient MSK, you're starting to get some EMG experience and outpatient neuro rehab. You also spend some time over at the VA in our musculoskeletal and polytrauma clinics. You also are doing dedicated selectives with sports medicine and interventional pain. You may wonder, well, why does it say 2 to 3? So, if a particular person's interest is in a brain injury rehab, then they may get 3 months. And if someone is not as interested in a brain injury, then they may get 2 months. You have to get brain injury rehabilitation as part of your ACGME requirements, but we certainly have the ability to modify the number of months you do based upon your interest. So having that flexibility for each resident is really nice to have. Going into our PGY 3-year, this is where you get from an inpatient side, your spinal cord injury rehab and your general rehab. You additionally spend time at the VA where you're doing amputee and consults. You're also getting inpatient amputee not only at the VA, but this is also where you get inpatient amputee on general rehab. This is also where you start getting your pediatric exposure with our Shriners Hospital colleagues. You also have an elective this year. You go back to the Cardinal Hill Clinic, and this is the Cardinal Hill Clinic 3. So this is where you're doing more EMGs, more outpatient musculoskeletal medicine and neuro rehab. And then you're also start to do the teaching utility team. So this is a team that is in our inpatient rehab facility that is meant to be essentially a junior attendingship where you are kind of running everything. You're signing and talking to the attending about pre-admission screens, who is appropriate to come, who isn't appropriate to come to rehab, and you're pretty much running the show. And so that is, that is new as of last year, and it was meant to, continue to get people ready for inpatient physiatry if that was what you so wanted to pursue. And then let's take a look at our PGY 4-year. So this is where we get a lot of our EMG, but as you notice in the Cardinal Hill clinics, you're getting it as early as PGY 1 and PGY 2-year. But you do 3 to 4 months over at Cardinal Hill, dedicated EMG, and then you also go to the VA for dedicated EMG experience. As a 4, you also go back to the teaching utility team. And then you're also doing your inpatient consults with Dr. Anna Carrico at Chandler Hospital, which we'll talk about here in a minute. And you also have an elective, your PGY 4-year. Talking about electives, so electives can be whatever you so choose. So this is just a short kind of list of some of the ones that have been done before. But if you wanted to mix and match an experience, you certainly can. So for example, when we had one resident in the past couple of years do an administrative and leadership elective, they wanted to know more of the administrative side of the hospital. And so this resident spent time with the CMO, the CEO, all the way down to all of our janitorial staff and what their day in and day out look like. And so if that's something that so suits your fancy, that is something you can do. If you want to do a dedicated spasticity elective where you're working with Dr. Key in brain injury, myself on stroke, working with our VA colleagues, you can pretty much mix and match whatever you would like to do. So there is a ton of flexibility. If you want a whole research elective, you can do that as well. So I'll let Dr. Key at the end talk a little bit about resident wellness, but these are some pictures throughout the years. These are both during the times of our the holidays. This was a couple of the residents. It was a couple years ago. This was at our annual Christmas party. And you can see that we like to have fun together. We like to work hard and play hard. We have 2 dedicated resident research retreats each year, one in the fall and one in the winter. This is a couple of pictures from those events. Our wellness champion, or our research of wellness, or our chair of wellness, is Dr. Roos. So she stayed on. We were co-residents, and she's going to be bringing a whole bunch of awesome opportunities to our program. We're going to start some book clubs, doing some running groups, some hiking groups. So I really am looking forward to seeing what she brings to the program from a wellness standpoint. Talking about didactics, so it occurs every Tuesday and Friday from 7 a.m. to 9 a.m. and this is completely protected from all clinical responsibilities. So, for example, Dr. Key gave her lecture on Intro to TBI today. I took all of the pagers and I was answering pagers for those 2 hours. And so that way that our residents can focus on what is being taught and not have to worry about different patient issues or pages that might come up. Some of the features of our didactics includes chief rounds. So this is a combination of not only grand rounds and guest lectures, but also our resident lectures, such as our formal presentations that our PGY3s do. This is also where our oral board prep is incorporated as well. And then we also have a dedicated SAE review course that occurs in January. That is Dr. Key's baby. And it is a comprehensive review that goes through and utilizes multiple resources, including Cucarillo, multiple Q banks, PM&R recap. It's a really awesome course. These are some of the locations that we do rotations at. So first off is the Chandler Hospital, or UK Medical Center, Chandler Hospital. It's a 945 bed acute care hospital. That is a level 1 trauma center, a level 1 pediatric trauma center, a comprehensive stroke center, and a National Cancer Institute. I just found out from one of our current interns that we are #1 for the sickest patients in the nation that come to this hospital. And if they go to that hospital and a lot of them need rehab, they're coming down the street to us. And so we take care of very high level and very sick patients here at Chandler. And then actually just got an email today from our leadership at Chandler that for 7 years running, we are now the #1 hospital in Kentucky. Talking about Cardinal Hill, as I mentioned, it is right down the street, about 5 minutes from Chandler. It's a 232 bed freestanding rehab hospital. It not only has our inpatient units, it also houses our outpatient therapy facility, our outpatient clinic, and has 2 therapeutic pools. And then some of the technology that is available for our inpatients and outpatients is listed below.
5 minutes.
If you want to talk about Lexington, if you have never heard about it, so it is population is about just over 300,000. If you think of Kentucky, you probably think of horses. We are the horse capital of the world. And then, you know, all of those grading systems were apparently the 8th best city to live in America and the 3rd safest city to live in the country. These are some of the pictures. You have a little mix of everything. If you want the city life, you can so choose. Or if you want the outdoors and you want to hike, there is some awesome hiking. If you love horses and you love horse racing, and you can have it here. And Dr. Key will shake her head, but if you want to watch really good basketball, we got that as well. One of the things I want to emphasize, again, we just touched the highlights of our program, but now what we do is, and this is for 3 years running as well, is we do a thing called Wildcat Wednesday. So we meet every other Wednesday. We had our first session on 7/6, and we talk all things regarding the match, and we talk also introduce you to our program. So our last session that we just had was on the application process, ARIS, personal statement and letter of recommendation, providing just some general advice, because at the end of the day, we know that we can only have and accept 5 people in our program. And so we know that you may end up somewhere else and we want you to succeed. And so that's why we offer these. And so our next session will be in August. I will put the sign up link in the chat if you so choose. If you can make it, we'd love to have you. If you can't make it, then that's okay. But we would certainly love to see you, to introduce you to the program a little bit more. But then also maybe you can get some tidbits about the match. Our next session will also be about the supplemental application and signaling that is new this year. So with that, I am going to stop sharing, and I want to turn it over to Dr. Key if she has anything she wants to add and any questions you guys might have.
Hey everyone, it's good to have you all and good to be a part of this again this year. Andy Man, thanks for having us back. Sloaney's making a guest appearance here and has preoccupied me during this lecture. So hopefully Dr. Nick did a good job. I'll just let you guys ask questions as you want. So we make sure that we field anything that you have in particular to UK. As he said, Wildcat Wednesday is a great way to get to know our program. Oh, you are talking. It's a great way to get to know our program. We started it when everything first went virtual, and we do try to help you through the process of just trying to get your spot and match where you belong. So come and join us. It's every 2 weeks, and our next one, as he said, is first week of August, next week, whatever next Wednesday is. Val, you get the spotlight too, unless others have questions.
So I see a quick question on call. I'll do my best to explain this in a short amount of time. So it is split into week call and weekend call. So it is all home call during the week. So call starts at 5 p.m. during the week and goes until 7 a.m. the next day. On Fridays is when the pagers switch. We have an upstairs and a downstairs team. You will go in on Saturdays and Sundays to go in and round with an attending if you're upstairs, and the same thing for downstairs. And that call lasts from Friday at 5 p.m. until Monday morning at 7. You typically get a little bit more call during your PGY2 year. And then as a PGY4, you are only on backup and on pump call. So you are helping out your PGY2s or 3s if they have questions while they're on primary call. And then any pump, backlift and pump that comes into the emergency room, you are troubleshooting that with one of the pump attendants.
I did see the question about OMM. We do quite a bit of it, actually. We have some folks in our outpatient clinic, the MSK side of things, that only do that. And so there's a lot of space to grow that if you want to do that during your rotations. And
I did it today in my neuro clinic.
We are working on getting the dual accreditation too. So that should be up and running pretty soon, so that you can sit for either board. I did want to point out, as you saw in our rotations, when you do a certain rotation in a certain part of rehab, you're doing only that, which is really cool and unique to Cardinal Hill because it's such a big place. And so when you do brain injury, you are saturated in brain injuries. When you do stroke, you're doing stroke. When you do spinal cord, it's all spinal cord patients. So you get to dabble very deeply in each of those categories and really take a deep dive into each curriculum, which is really nice.
Victoria, I see your message real quick. The feedback is great. Dr. Key really takes pride in making sure that the rotation schedule is best suited to each individual's interest. I think just having that ability to be flexible and to have administration from the top down listen to resident feedback is critical. I can give you more specific feedback, but I know we're running out of time. I'll stay on, and Dr. Key and Dr. McDermott we can field questions as well.
Yeah, and I'll put my email in the chat too, so you guys have it if you need anything. But we love to hear from you all during the application cycle. This is one big happy family in PM&R, so even if you don't end up at UK, we'll be talking throughout the years. And Victoria, I'll answer your question in the chat, just so we'll keep this thing going and Andy can do his job.
Wonderful presentation, guys. Thank you guys so much for your time, as always.
Thank you all.